Hi everyone, my name is Emily Kazarski, and today I will be talking about iron. Iron has the symbol of Fe. Its atomic number is 26. Its atomic mass is 55.85. Iron has the longest history out of any micronutrient. In the 16th and 17th century, there was a condition known as chlorosis, which was later defined as iron deficiency anemia. In the 20th century, it became known that iron was needed in hemoglobin synthesis. There are 2.3 grams of iron in a woman's body, and there are 3.8 grams of iron in a man's body. Almost 2/3 of body iron is found in the hemoglobin form. About 25% of iron is found in the ferritin form, which is stored in the liver, the spleen, and bone marrow. About 15% is bound to myoglobin in muscle tissue and various other enzymes involved in oxidative metabolism. Almost all cells use iron for biochemical activities, including oxygen transport, energy metabolism, and DNA synthesis. Iron can also be toxic to the body, though. Under aerobic conditions, it catalyzes the circulation of reactive oxygen species and produces highly reactive radicals. Iron goes back and forth between its reduced form, ferrous iron or Fe2+, and its oxidized form, ferric iron or Fe3+. As it goes back and forth between the ferrous and ferric form, it disrupts cellular equilibrium, thus ensuing oxidative stress. Oxidative stress can lead to tissue injury and disease. Iron is tightly regulated in the body. There is a hormone known as hepcidin, which is a peptide hormone derived from the liver. Hepcidin regulates iron metabolism in the body, and is compared to the action of insulin in glucose metabolism. Hepcidin accumulates post-iron intake, and if there are inflammatory conditions present, it causes decreased dietary iron absorption and iron retention in the macrophages. During infection, this is beneficial, because it makes sure iron is not provided to invading bacteria, which is necessary for the bacteria's growth. On the contrary, hepcidin levels drop when there is a deficiency. This promotes iron absorption and the release of iron from the macrophages. As you can see, in case of depletion, there are mechanisms in place to use iron stores. There are no mechanisms, however, to eliminate excess iron. Let's talk about deficiency and toxicity. As far as deficiency goes, iron happens to be the most common micronutrient deficiency. It affects about 10% of the population in developed countries and about 25% of the population in developing countries. It's most common in children, adolescents, and pregnant women. For pregnant women, there is an increased iron requirement because the placenta and fetus are growing rapidly. Adult men and postmenopausal women are at a low risk of iron deficiency, and typically there is enough iron in their diets to support their needs. There are 3 stages of iron deficiency. The first stage is a mild deficiency, which is known as storage iron depletion. Here, iron stores are depleted, but there is still a functional supply in circulation. The second stage is when functional iron levels are decreased, so the formation of red blood cells is impaired. And the third stage is iron deficiency anemia, which is the most severe. Here, there is no longer enough iron for red blood cell formation. This stage can also occur when there are stomach ulcers or any kind of chronic bleeding, such as colon cancer, uterine cancer, polyps, or hemorrhoids. It can also happen due to chronic disease that interferes with the body's regulation of hepcidin. Iron deficiency anemia can also happen due to kidney disease, where the production of the hormone erythropoietin that makes red blood cells is compromised. Symptoms of iron deficiency include fatigue, increased heart rate, glossitis, atrophy of taste buds, spoon-shaped nails, and more. For toxicity, if one is consuming iron from food sources, he or she is at little risk of overdose. Toxicity most commonly occurs from 2 different iron storage disorders. The first is hereditary hemochromatosis, and the second is hereditary anemias. No one should intake more than 20 milligrams of iron a day. And symptoms of toxicity include rapid pulse, difficulty breathing, vomiting, and lethargy. Food sources and recommended intake. Heme iron is obtained mostly from animal sources and is better absorbed than non-heme. Non-heme iron is found in dairy products and plant sources. There are certain dietary factors that may decrease or increase absorption of non-heme sources. These can include vitamin C, which enhances absorption, organic acids such as citric, malic, tartaric, and lactic, which enhance absorption, oxalates, which reduce absorption, phytates, which reduce absorption up to 50% and are found in beans and greens, polyphenols, which can reduce absorption up to 60% and are found in coffee, wine, spices, and fresh produce, and soy, which can also decrease absorption. Great sources of iron include things such as fortified breakfast cereals, oysters, white beans, dark chocolate, beef, liver, lentils, spinach, tofu, sardines, and chickpeas. The RDA for adult women is 18 milligrams, and the RDA for adult men is 8 milligrams. The RDA for pregnant women is 27 milligrams, and lactating women is 9 milligrams. Nutrient interactions include things like a vitamin A deficiency, which can simultaneously cause an iron deficiency. Iron can interfere with vitamin E absorption. Manganese and zinc can inhibit iron absorption, and calcium decreases absorption of both heme and non-heme iron. Iron supplements are not recommended unless there is a clear deficiency. They are best absorbed in between meals, and the best absorbed type is ferrous fumarate, while the worst is ferrous sulfate. As far as assessment goes, iron deficiency anemia is discovered by testing the hemoglobin levels in the blood. If a woman's hemoglobin level is below 12 grams per deciliter, then she is anemic. If a man's hemoglobin level is below 13 grams per deciliter, then he is anemic. Disease prevention and treatment. Iron can prevent impaired intellectual development in children. Anemic children can have behavioral problems and achievement problems in school. Iron can prevent lead toxicity as decreased iron levels lead to increased lead absorption. Iron can help prevent pregnancy complications, including the risks of preterm labor, the risk of having a child with a low birth weight, and various maternal complications. Iron also helps prevent impairment in the immune system, as it's required for killing off pathogens. Drug and nutrient interactions. Iron should not be taken with antacids, as they can interfere with absorption. They should not be taken with a medication for gout known as allopurinol. Iron supplements should not be taken within 2 hours of certain other medications, such as thyroid medication, medications used for Parkinson's disease, medications used to treat high blood pressure, and various antibiotics. Here you will see my references. And that's it. Thank you so much.